If you're in healthcare leadership, you probably have heard the following phrases. You're too fluffy. You're too soft. You need to be tougher. You may have heard that. In my first leadership role, I heard that I was just too nice. Well, I have actually grown in my leadership role to where now I serve several hospitals for a wonderful healthcare organization. And I don't feel like that I have changed necessarily of how I value people, but I have learned to be more decisive and never forget the value that people bring to the table as they take care of patients and as they work to achieve the mission and vision of the organization. So that has not changed in my leadership roles. And as I've grown throughout my career, I've been more committed to spreading the message to help other leaders realize that mercy is not being too soft, but it's actually a great strategy. Mercy is a strategy that will help build loyalty in organizations and help build retention, as well as create a culture to where people will not have fear, but yet they'll want to commit to the mission and vision of the organization, and the results will be achieved through showing compassion and accountability together. So let's talk about this myth of being tough. When I talk about mercy, I'm not talking about letting things go within the organization to where people will do whatever they want to do and there's no level of accountability. What I would actually like to focus on is there is room within leadership to have accountability and compassion. What an equation together of how to treat other people the way that they should be treated and to show them that they are valued within the organization. I once worked under a leader one time to where I remember my name kept being called throughout my shift over and over and over and over. And sometimes I wondered if that leader actually realized the detriment of how they were leading at the time and during that moment of my career, because I would go home after that shift and I would still hear my name being called down the hallway. And it created an environment where, although I knew that this leader cared, it made me wonder if she actually valued me as an individual team member or if I was just somebody to get things done for that leader and there was no value of the human side of who I was. Yes, results are gotten by being tough. I cannot debate that at all. And people sometimes feel like to get results, I've got to put more pressure and be more firm and I can get results. What if we changed the way we thought in traditional leadership and we decided to actually create an environment where we showed more empathy and we showed more compassion toward others to get to the root of who people actually are and figure out what influences them the best. Now, I've been direct sometimes in some situations of leadership, and I think there are times that it requires that. I have been not necessarily elevated to the point of yelling, but I have been firm in my conversation because that's not my normal. And by the firm, direct communication I had with individuals, they realized, yes, this point needs to be made, and they had to decide how to deal with that information that I gave. But I never lost the value of who that person was individually and realizing that I'm talking to another human being. I never lost that. I never lost the importance of knowing that I have to show compassion and I have to show love and empathy to people that I deal with. I never lost that. I did bring in the accountability side because there has to be structures within organizations and accountability. But when we think about the power of merciful leadership really is not letting people off the hook. It's not actually excusing underperformance. It's leading with both what I talked about earlier, the accountability and compassion. Mercy says this, I see your humanity, but the accountability says, but I also expect excellence. It says, I will correct you, but I will not crush you. It says you are more than your output. You are a human being, but I feel like when we realize that people are human beings and we deal with them on a human level, as that gets inputted into their own mindset, the output will become more and the results will still be achieved, but yet we have been able to show mercy. There are strategic benefits of mercy, and I've seen this in my over 30 years of healthcare experience of the word mercy and how that action word leads to more loyalty within an organization. It's crucial. People will want to stay because an environment has been created of compassion. And then I've also seen this C word called contagious, because once you start leading with compassion and empathy in a workplace with mercy, an action word of mercy, then I've seen that become contagious among the workforce, and people will actually want to do more for you. I'll give you an example of one time as a chief nursing officer. I had asked for this certain task to be done, and the task never was completed, and it was related to patient care. And so I found some of my team members in the break room congregating together, and I went in to ask about why this task had not been done. There really wasn't the best excuse at all, and I walked out and I went and performed the task myself. Now people will say, well, Dr. Jeff, you may probably have enabled them to never do that for you. But here's the impact that it made. The impact that it made is, especially one of those team members saw me doing that task and came to me and apologized and said, what really got me was not that you came into the break room and we found us in there and we had not completed the task you had asked. But they said what got me was seeing you, the leader, having to do that task. And from that example, because I was not afraid to do any of the tasks that I had expected of my team, from that example, I never had that same issue out of that team member. I also remember another time where a nurse came to me with a syringe in hand, and they said, that nurse asked me, is this 5 units? That nurse knew it was 5 units. They knew it was 5 units on the syringe. It was there. It was 5 units. And I wondered, why did this nurse ask me if this was 5 units? However, what I did was I responded back and confirmed and validated that that was 5 units. And that nurse, being a great nurse, for whatever reason, asked that question at that time. I treated her as a human being. I answered that question. I knew she was a great nurse. I had no concern about her ability to provide care to our patients. And she continued to perform very well as a nurse throughout her tenure with the organization. But she needed that human-to-human aspect to where I, as the leader, validated and answered the question that she had. And I know there are times where you get questions and you're thinking, are these people even thinking? Why are they asking me this question? But I want you to realize that sometimes by showing mercy in the workplace, it's crucial. So here's what I want to present to you as mercy as this mental model for you to have in your mind as a leader. First of all, the letter M means to model empathy in the workplace. When we learn to do this and learn to come at it from a non-judgmental attitude, but one that actually shows empathy towards other people and look to the reasons why people behave the way that they do and what structure they may need to individually influence them, we make a tremendous impact in our organizations. Number 2, E means to empower and trust. We can trust but validate, but we need to trust the people that work in our hospitals. We need to trust them as professionals, but we also need to make sure that we are ensuring they have the skill sets and validating those skill sets, but also we're giving them the resources as leaders to be successful. R in the letter mercy, the letter R in the word mercy is to reframe failure as growth. So when we're dealing with the sense of accountability and somebody makes a mistake in our organization, instead of hammering and crushing them as a human being, we can reframe that as an opportunity for them to grow and to learn how not to commit or prevent them from failing again in the same mistake. And when you do that, you create an environment during that process of accountability to where they feel like that they can come to you either with issues that they are experiencing, but also with ideas they may have to better the workplace. C in the word mercy would be communicate with compassion. Compassion is such an actionable word, and it comes not only through giving praise and also giving confirmation and making sure that people feel like they're doing a great job, but it also means that sometimes even when they're going through things, compassion will lead us to communicate individually to find out what's going on. Why are you different today? Can I make sure that I'm showing compassion in my communication, either through the way that I'm acting, my verbal responses, my physical responses, the way my face looks when they're talking to me? Am I rolling my eyes? Am I raising my eyebrows? Or am I showing compassion when they're talking to me? That's a big one. And then why would be to yield grace without lowering standards. So that's where the accountability and compassion come in. You can have a disciplinary conversation with a team member while still yielding grace. I liken it to this, especially in my book, Mercy Leader. I liken it into when I'm doing a disciplinary action, that has to be done because that's the accountability that's required and the standard that's required. But also during that situation, when we're having the disciplinary action, once that's put away, that standard's put away, it's time to have a conversation. A conversation of, as your leader, how can I serve you so we can prevent this from happening again? It creates a different outcome from a disciplinary action, and team members will feel valued, or sometimes just because it's a disciplinary action, they may not, but that really then becomes up to their own mindset. So I wanted to give you mercy, M, model empathy, E, empower through trust, R, reframe failure as growth, C, communicate with compassion, and Y, yield grace without lowering standards. So here's what I want to ask you. Where can you trade force for mercy in your leadership? Think about it. Where can you trade force for mercy in your leadership? Because I believe that you can use mercy to influence others, and you can incorporate that in your daily leadership that will literally, before you, transform the lives of the people that you serve. If this message hits home for you, I want you to subscribe to my channel and share this with other leaders that you know where this may provide benefit. Hit a like and let the algorithm take this video to make an impact for other people, to where mercy is not weakness. Mercy is a strategy. As we serve together, Dr. Jeff.